I turned 40 years old, I noticed my hairline was really starting to thin, and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money, and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus, it's gonna help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
Oh my gosh, I love that we can start with that. I know the last time we had an Adrian Capillus, Martino was here. He is so passionate about it. And the reason is it worked and it changed his life. It can do the same for you. You know, I mentioned a little earlier, you know, as we age, guess what? Our hair ages as well. So if you are finding yourself embarrassed, walking around wearing hats, trying to part your hair a different way, everything you do to your hair, you keep losing your hair. Well, what's different with this purchase today is that you are looking at a product today that will literally regrow your hair. Look at this before and look at the after. Thicker, fuller hair. And it doesn't matter what your hair type, it doesn't matter what your ethnicity. And look at this for women. You know, right as our hair, you start to part your hair and it's like, oh my gosh, you know, am I going gray? No, you're actually losing your hair. Well, let me tell you what this is. This is an FDA-cleared baseball cap. I love it because it's so indiscreet, right? Nobody even knows you're doing it, but when you're wearing it, look at what you are wearing. You are wearing 102 lasers inside this hat that will literally help to regrow your hair. And I always say this in the very beginning, this is not a cosmetic solution, this is a medical solution. Today, we have it available on a great event price of $1,600, as you can see, at $99. We will ship it to you for free. It is on 6 flex pay payments. And then the most amazing thing about this to me, it is a one-time purchase. Well, without any further ado, my pleasure to welcome my special guest, Barry Pinter, who has been in the industry for you've been around this hair world for like over 30 years, Barry.
You know why? Because I suffered from hair loss like much of my family, because it's typical, something that we know, we inherit it and we have to deal with it.
Right.
You know, so many people wake up, it's a Monday morning. I know you may have woke up thinking, I have to spend another week dealing with hair loss. Well, here's the most important thing I want to tell you. I worked for a very large medical facility meeting with people just like you every day, who at some point would wake up on one of these Monday mornings and said, this is it, I'm gonna do something today. It's raining, it's windy, it's hot, it's humid. I'm sick and tired of being sick and tired. And I wanna tell you with all the sincerity that I can, having worked with so many doctors, that almost every time when these folks were dealing with hair loss, I would recommend this exact technology known as low-level laser therapy. It is, as Bobby said, an FDA-cleared medical device. And Bobby, that's huge because folks have been ripped off for so long. And here, we can see what's happening with this hair. This is how hair loss happens. It shrinks. It's called miniaturization. It'll eventually shrink till it's completely gone. So what we need to do is catch it before it's completely gone.
Right.
Bring in a medical-grade, healthy red light that's actually going to stimulate the cells in that follicle and make it regrow like Yvonne. Right here, as you showed earlier. Yvonne is a perfect example. She would be someone who would come into my office and say, Barry, please can we stop my hair from falling out? That's all she wanted to do. Yeah. But I was able to tell her we could not only stop her hair from falling out, we can help to regrow the hair, as you see in that after. Typical hair loss pattern for a female. The part gets wider and wider and wider. She just wants to say, please stop my hair from falling out. Well, look what happened 12 months later. It not only stopped, it regrew in, it's filling in. It's going to do even more than that. Look at the sides, how healthy. Look at the bangs in the front. Look at Lester after 3 months. Yeah. Now, we're giving you 6 months because we're talking about growing real hair with a real medical device. As you said, not a cover-up, not a trick. Your hair, you cut, you color it, you curl it, you do whatever you want, and it's a permanent solution with a simple 6 minutes a day, really quickly. And look at this. Look at Daniel. See, I love Daniel because, first of all, he's 6 months, just what we're talking about. Right. That's why we're giving you 6 months. You get to grow the hair.
Yeah, we've never done a 6 months return policy.
Yeah,
so
but
why I
because
love
we're
that.
talking about growing real hair,
Right,
you
right.
need that 6 months. You need to be patient and do it every day for 6 minutes a day. Daniel's hair comes in. My hair's falling out. Please stop it falling out. Great news, Daniel. We have a medical device that will not only stop it falling out, we're also going to help to regrow it, as you saw, with an amazing FDA-cleared device.
I love what Martina said, because Martina said, remember, they said, sure, I mean, I can give you the plugs for your hair, but it's not going to stop the other hair from falling out. I thought that really hit me, and I went, yeah, because how many people out there are going and spending either, I will speak my brother-in-law, hundreds of dollars a year to upwards of thousands of dollars a year on that, but you're not really, what are you doing? Then when your hair's falling out, you have nothing.
Well, yeah, and you know, doctors are truly our biggest clients, if you want to call that, our customers, because they supply this. A dermatologist, if you go to your dermatologist and say, help me stop my hair from falling out, it is quite likely your dermatologist is going to say, we supply Capillus medical device for you to use at home. Hair doctors, just like Martino's. Now, again, did you hear what Martino said? He didn't purchase the cap at HSN.
Right.
His doctor said, Martino, I want you to use Capillus cap. And as a matter of fact, we have a doctor that the home shopping world knows very well.
Oh, Dr. Dennis.
Yes.
Yes, we're going to share with you Dr. Dennis, but please listen to this and let this be the day if you've struggled. Today is the perfect day to make the purchase, and I will share with you, we have fewer than 100 of these to go around, so we have just this quick airing, one more show, and that is it. We don't know when it'll be back, but talk about the best investment you can make, an investment in you. Here's Dr. Dennis.
My name is Dr. Adrian Dennis. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
And I love it. Like, she's wearing a baseball cap. Like, nobody even knows.
As simple
I love
as
that part. Yeah.
And you know what I love? The fact that Dr. Dennis is sharing her story like Martino is this is someone we know.
Right.
The reality is I could bring hundreds of doctors on videotape, because we have them, because doctors use this, talking about how you should use it. This is someone you know, you trust in this world, who is a PhD and MD, who is saying, this is what I choose. So when we say doctor recommended, doctor uses, it's very true. And Sonia's going to show us how simple it is to use.
Exactly.
Welcome.
Hi, how are you?
Okay, so Sonia can be at home, Bobby, either vacuuming, doing stir fry, reading her favorite book. She pops on her head, she's going to tap one button, bam. Guess what? Her treatment has begun. So you see there are going to be blue lights that light up to let you know that it's going, okay? And if I tilt this up, look at that. Her treatment has begun. So Sonia will do whatever she wants for the next 6 minutes. A computer chip in this cap.
So 6 minutes.
6 minutes once a day.
Okay,
that is
6 minutes, one time a day.
Exactly.
You have that. And you know, one question I asked you last time we were together, and Sonia and I were both, wow, that I was thinking about this.
Yep.
What about as a preventative? Because like,
it's, you know what, it's huge as preventative, because we know as we get older, let's talk about females specifically, estrogen levels drop, right?
Yep.
We already know, a lot of us already know that helps keep our skin healthy. What we don't realize is it's also the estrogen that helps to keep our follicle healthy. And we know anyone who's dealt with anything at a doctor, doc will say, I want to keep you ahead of the problem.
Right.
That's just a very typical medical path. So if the minute you feel like your hair is thinning, and or you never even want to go there, this is a very safe FDA cleared option. And here's why it's great. The FDA allows us to say 0 known adverse side effects. So nothing to lose but full hair and the thickest and most healthiest hair that you can grow.
And you know, you and I talked about this, and I think this is so important that like women don't have a lot of options.
They don't, and medical options.
Medical options, right? Medical function, real options.
Yes, and that's one of the things I always tried to explain when I met with all these men and women, because they're like, well, I tried this shampoo. Well, I stood on my head. Well, grandma said it's because I'm wearing my hat too much, I'm not wearing my hat. No, really, I've been there. I've been there, right? I mean, you can see that I don't have hair here because I started losing in my 20s. But what I was able to do is take the hair that I still had, catch it before it died, and keep it. Okay? So, to your point, women have 3 options, period. And I would hit this really hard because there really only are 3. One is going to a doctor's office a lot and paying a lot of money for the rest of your life to get injections. Another is a topical that comes in many, many forms that you put on twice a day, comes in many, many different names. It's not a bad thing. You know, we can supply that as well.
Exactly.
But the easiest and most effective, according to meta-analysis clinical trials, is what's known as low-level laser therapy, which we have here today. And make no mistake, it is professional dosage of 202 laser treatment. So folks may have seen, well, I sell something for $300. Well, that had 8 lasers. I sell something for $400. Well, that had 40 lasers. I sell something for $900. That had 80 lasers. This is the 202 laser professional grade that Martino, Dr. Dennis, and I am so excited HSN has decided to answer.
I believe on the screen we're showing you who can actually wear this, Barry.
Okay, so this is what's known as the Ludwig or Savin scale of female hair loss. Again, folks sitting at home who have seen mom do it, has seen the aunt do it. So many people recognize this. The part gets wider and wider and wider, just like we saw in Yvonne earlier. The great news is that's not complete baldness, because all we're doing is treating a follicle. I say all, but with amazing medical technology. So if you're completely bald, let's say you're in that white area down there and it's shiny, bald skin. We do not want to mislead anyone to say you're going to grow hair there. Because there has to be a follicle. Again, just like I used myself. I'm not going to grow hair where I have shiny bald spots, but I can keep the hair that I have and thicken it, even if it's baby peach fuzz. Men, typical thing. That's also called the Norwood scale. We can see where those, they're thinning, but there's still peach fuzz, baby, a hair here and there. What that means is there's a follicle there. What that means is this technology, this FDA clear technology, can treat it, stop it from falling out, and help to regrow.
Okay, let me just share with you, because I have promised I have to keep you updated. We have 67 left. That is all we have for the entire country, and we have no idea when it's coming back again. And the bottom line is that this is, like I said, this is not a cosmetic solution. This is a real medical solution, and that to you, knowing right now at HSN, you can make one purchase. It is a one-time purchase. You own it. So maybe you're already suffering from baldness, but maybe you're like, all right, this is hereditary. Then there's my daughter who's coming up. Guess what? You have it, because I love the whole preventative aspect of it as well. Here's what I love. It's only 6 minutes a day. I love that it's FDA cleared. I love that you have an amazing opportunity here at HSN to have us ship it to you for free, to take advantage also of the 6 flex pay, not even $289 on any FlexPay, which means debit card, any credit card, PayPal, there's no layaway. We'll immediately ship it to your home, and that it is so indiscreet, like nobody even knows you're wearing it. By the way, you can take it out of this cap and put it in other caps too. And then that you have a 6-month return policy. Listen. We want you to get it home. We want you to use it. And you know what I know? I know when it's an electronic or even any beauty item, when it's easy, guess what? You're gonna do it. And when it's 6 months a day and you can still go about your life, and the bottom line is have that ability to literally regrow your hair. And you can't put a price on that. You cannot. You know, as a woman, like I said, even as a woman, even when you have hair, right? You know, you have a good day, bad day. If your hair's not looking great, or if you're embarrassed, as I said, you're wearing hats, whatever the case may be, this is the solution for you. I would love to share with you our amazing Martino Cartier. I'd love to share his testimonial again, if you don't mind, Barry, because this is so, it meant so much to us. Number one, that Martino did this, and this was way before we even had Capillus here at HSN, right? Here we go.
My name is Martino Cartier, celebrity stylist. When I turned 40 years old, I noticed my hairline was really starting to thin, and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money, and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus, it's gonna help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
I love it, and again, completely unsolicited. And like I said, Martino experienced it way before we even had it here at HSN. He didn't buy it from us here. And we were just talking to Sonia, who also bought it, and your son used it. So this is not, we're talking about women, but this is for men and women, right?
Oh, there's absolutely, as a matter of fact, women are the most passionate who came into me. So, I mean, think about it. I mean, I keep saying this, Sonia is stunning.
Absolutely.
Sonia is stunning a lot of reason because she's proactive in her stunningness. I don't want to sound crazy.
Yes, I love that word.
But you know what? Because
You're right.
You got to get, again, I can't tell you enough how much I have sat with thousands of people. And as weird as this sounds, I almost get teary-eyed when I talk about it.
Yes.
I've sat with 16-year-olds who started early, who said, please, I just don't want to wear a hat to my prom. I mean, I've heard, I understand the sad stories. I understand how painful it is. I understand that you've tried this, and you've tried this, and you've paid this much, and you've paid that much with nothing. That's why I'm here to tell you this is an FDA-cleared medical device of one of only 3 options that the medical community recognizes. This recognized as the most effective. If it's FDA cleared, that means the FDA says this is effective. That's what an FDA clearance means. It will work. If it's FDA cleared, the FDA says this is safe. So look, ladies, please, it's Monday. You don't have to go through this again. If you're thinking about it by Christmas, by pictures for the holidays, you can be transformed. And Bobby, if you're not, send it back. There's nothing to lose.
You have a 6-month return policy with this.
I'm just so passionate about this because it's so important. I mean,
and so different because you're getting, there are 202 lasers.
You're getting the professional strength, the professional grade. And that's why I say, if you're not sure, and I mean this passionately, get it home, because you're saving a lot of money. I don't want to talk about the money, but let me tell you something. This is an amazing price for this profession. If you go to your doctor's office, you're going to pay several hundred more.
Absolutely,
but look, get it home, take it to your dermatologist, take it to your doctor, say, hey, this guy told me this is a real medical device, is that true?
And we're going to show you again how it works also.
Sonia's going to show you how easy it works.
We have only 60 left, the final 60 remaining. And the importance is, again, because your hair obviously grows in cycles.
Yep, so here we go. It's called miniaturization is the medical term. See it getting smaller, Bobby? Smaller and smaller and smaller. That won't stop like it freezes in this animation. It'll be gone. That's permanent baldness. We want to catch it before it goes. Bring the specific spectrum of light down to that follicle. What it's doing is it's stimulating the cells in that follicle back into the growth phase. It not only stops it from falling out, it's regrowing that hair and all the hair around it so that you could be proactive, like Sonia, like Dr. Dennis, like Dr. Dennis, like Martino. I mean, really, Bobby, truly.
Exactly.
I mean, it's just worth taking that plunge for 6 months, no risk.
100%. And by the way, you, as I mentioned before, you can take it out. You can put it in any cap. We're just giving you the cap that comes right along with it. You have the 180 days, the extended return policy. How many are left now, Kyle? I think it was like, holy cow, I have only 56 remaining for the entire country.
And they sell out every time.
And it's a one-time purchase, because honestly, if you're out there, if you have, like I have a family member who's going, you know, for all the plugs, and what do you, he's so bad. It's like, oh, it's so much money. I'm just going to extend another month, and it looks awful in between. And then guess what? Even if you have that done, you can't do anything about the other follicles because those follicles are going to fall out. So even if you are, you know, going in to get hair replacement, here, this is what's different. You're growing hair. You are regrowing your hair as long as that follicle is here. And then here's the best part. You ready? Because you're like, oh, I don't have hours a day. What am I going to do? I'm busy. 6 minutes. 6 minutes a day. 6 minutes a day is all this takes, Barry.
And watch Sonia do that 6 minutes. You ready?
All right, this is all she does.
She's going to pop it on her head.
Boom.
What does she have to do? There's one button she's going to tap.
She's done.
Computer chip takes over, turns it off automatically 6 minutes later. Now, you may have noticed it's on, but when you lift it, see how it goes off? Those are safety features in there that if it's not on your head, it turns off. But when she puts it back on, the treatment resumes.
Oh, yeah, you can hear the beep,
it's a no-brainer. But here's the thing. If you're like, Barry talks too fast, I have no idea what he's saying. Or you get it home and say, wait, what? This is a USA-based company where it is manufactured in the USA, customer support is in the USA. You will get an 800 number that you can call, ask questions all day long, email, you'll have all that information. We are there to help you regrow your hair,
Yes.
I promise.
And all I can say to anyone out there is just, this is so important just for you. I know as a woman how important it is, you know, how we feel about our hair. So if you're out there and you're struggling and you can relate to any of this, and maybe you've tried a lot of other options, you know, we discussed a lot of the other options, they're cosmetic options. This is not. This is a medical option today. And for one day here at HSN, and this is clearly why they last, with only 56, probably even less than that now, 48. So I have only 48. Like, I want to cry, honestly, because this to me, I mean, this changes people's lives.
I seriously get weepy
Right?
because I've sat with the women crying. This is, if you're suffering from hair loss, this is huge. You deserve to do something about it.
Absolutely. 6 flex space, what is it, $289? That's on any credit card, debit card, PayPal, no interest, and it's not layaway. We're gonna ship it immediately due. And then I love the fact that you said, Barry, by the holidays. Think about that.
Think about
how
that. The
fabulous
pictures.
your hair could look in the photos.
You're not going to run from the picture. You're going to say, I'm in.
Yes, yes,
You know,
yes,
seriously,
yes.
I see it all the time. Look at
Yeah.
Daniel. Look at Daniel 6 months later.
Yeah,
His hair not
look
only
at
stopped
that.
falling out, look, that hair regrow. Okay, so this is Daniel today. Look at Daniel in the Christmas pictures.
I know.
No, seriously, I mean, we
You're
need
right.
to give you the reality. Get it home. Take it to your doctor. Say, doctor, I bought this. Should I use it? He'll say, amen. Go for it.
Go for it.
Yeah, if he doesn't, if he says no, send it back. If you don't look like Daniel, you look like Yvonne. If you don't look like that, send it back. That's why I genuinely love that HSN is offering this professional doctor's grade.
Quick,
people. It's
simple,
awesome.
easy, and it works. Thank you so much,
My
Barry.
pleasure.
Thank
We'll
you,
be on at
beautiful
4
Sonia.
again if you want to
4 o'clock with
call
whatever's
someone,
left.
say watch. Yeah, exactly.
The final
Sonia and I will be back.
43 left. I may not make it till later on, but the final 43, so definitely stay right where you are. But now you want to look up close at all that gorgeous hair. We have an amazing mirror that we're going to share with everyone right now. Here you are looking at